Good morning, everybody. Welcome to Morning Rounds, where we come together for honest conversations about key initiatives, strategic priorities, and the incredible work happening across Stony Brook Medicine. Today, we're focusing on a topic that's close to my heart and essential to our success as a health system: employee engagement. I'm joined by Colette Brown, our Chief Human Resources Officer, to talk about why your feedback matters, the many ways we're investing in our people, and how your voice directly shapes the culture here at Stony Brook. So, grab your coffee, settle in, and let's get started. Good morning, Colette.
Hi, good morning, Bill. So nice to see you.
Nice to see you, and thanks for joining me today.
My pleasure.
So let's get right to the big question. Why is it so important for everyone to fill out the employee engagement survey?
Yeah, absolutely. I mean, really, the engagement survey is one of the most important tools we have to measure and take a pulse on how our employees are feeling. What's working, what's going well, what's not working, what can we do better? And we really use this feedback to help guide us in continuing to build and nurture our culture of respect and engagement. And we know that when we have an engaged workforce, that it positively impacts our patient outcomes and our patient experience. So it's really vital.
What areas of information do you try to glean from the employee engagement survey so that you can use it going forward?
Yeah, we get a lot of really valuable feedback. In particular, we look at how are we doing as leaders? Are we supporting our employees in the way that they want to be supported? Are we asking for their input? Are we taking their input and working with it? How are our communication vehicles? Are we getting them the information they need in a way that is useful and helpful to them? We also look at things like teamwork. Are we working collaboratively across different units? Compensation, are our pay rates competitive? Staffing levels, are our staffing levels adequate? So there's really a number of different areas that we look at, and we look at each of them very carefully.
That's great. You know, one of the things that I think is hard for people who have been working here for a while is to get a sense of the timeline over which things change, or wondering in a big organization like this whether their voices are heard. If somebody says to you, why should I bother? You know, no one's going to listen, no one's going to do anything. What would you say to that employee?
I would say, it's a good question, because sometimes it is hard for employees to really see that direct connection between filling out a survey and all of the things that happen after the fact. But we could share examples with them of specific things that we've done over the years that really have come directly from the feedback they give us in the survey and also throughout the year. Things like the reward and recognition programs that we've built over the years. We've built many. Things like the enhancements we've made to compensation programs, the leadership development training programs we've put in place, because we know that there's such an important connection about how employees feel about their work and their relationship with their supervisors. So we can really tie very specific examples back to their feedback.
So all of those examples you just mentioned came out of feedback from the employee engagement survey.
Yeah, absolutely.
That's great. That's great. I want to ask a little bit about the Leadership Academy that you mentioned. Tell me a little bit more about that. When did it start? And who is eligible for it?
Yeah, sure. So we have a couple of different things. One, we have our Leadership Education and Development Workshop, which is the leadership training we provide to those who supervise others. And then also recognizing that in many cases, both within Stony Brook and outside of Stony Brook, there's always that challenge. I want to be a supervisor, but how do I get my foot into that first position, so to speak? Right? So we developed the Leadership Development Academy to help employees who do not have any supervisory experience, but who aspire to someday become a supervisor, to give them some of the tools that they will need for them to be successful in that role. So the Leadership Development Academy is a 9-month, an 8 or 9 month, both an educational and experiential opportunity for staff to participate in a program. We have virtual instructor-led courses. We have asynchronous self-study courses that all culminate with the employees, or the students in this case, coming together on a big project at the end. And they work on this project together. They basically identify a real live opportunity within Stony Brook Medicine, and they put together recommendations on how to improve. And in this past, we select the students. They basically apply.
Mhm.
We just look for employees who've been with us for 3 years, who have a good work history, and who have not had the opportunity to be supervisors before. And then we bring them into the program and into the cohort. And it's been really successful. And we've put in place many of the projects they've recommended.
Oh, that's
So they're
great.
absolutely helping with our mission and our goals. And the enthusiasm has just been really exciting.
So you could argue perhaps that those projects that you've put in place that have come out of the Leadership Development Academy really are indirectly a result of the Employee Engagement Survey.
Yeah, absolutely. Because the Leadership Development Academy was a suggestion that came out of the survey.
Right.
Yeah.
Oh, that's great. That's wonderful.
Mm.
Thank you. So you collect the survey,
Mm-hmm.
the results come in.
Mm-hmm.
Tell me the process. How do you look at it? How do you analyze it? What comes next?
Yeah, absolutely. So we partner with Press Ganey. Press Ganey is actually the third-party vendor that conducts the survey for us.
Mhm.
And they're probably the leading surveyor of healthcare employees in the country. And the nice thing is, by using an outside vendor, all of that survey data is anonymous. So we ensure the anonymity of every single employee. And after the survey, what Press Ganey provides us with is basically the compilation of all of that data. So we tell them how we want the report sliced and diced. They won't give us any data unless at least 5 employees responded in a particular unit. So for example, if we want data on a particular nursing unit, how did our employees in this nursing unit respond? How is the leadership doing in this nursing unit? We will only get their scores if there were 5 or more employees, and that's so we can ensure their anonymity. But then once we get that data, we can look at it, and we look at it in a variety of ways. We look at how are the employees feeling about the relationship they have with their direct supervisor? How are they feeling about communication and all of the other things we talked about? And then we work together with our department heads to develop individualized action plans for each
Mhm.
department. So we say, okay, Bill, here's your department. This is the feedback. Let's talk about what we're going to work on. But it's not just the supervisor who is coming up with the action plans. The supervisor is then charged with bringing that data back to their employees and saying, hey, everybody, this is what you shared with us. Thank you for this feedback. Let's dig through it together and let's brainstorm what are some of the things we can do as a team to make the work environment even better for all of you.
That's great. So it's another tangible way for people to see how the input they provide on the survey translates to tangible results.
Exactly.
That's great. And that sounds like a long process, right? How long do you expect before, as this whole thing is unrolling?
It is. So this year our survey will roll out in September. We'll have about a 3-week window, September through October. We'll probably get the results back November, December-ish.
Mhm.
And by January, we're communicating them at our town hall meetings. We're communicating them out with staff. And then probably over the next 2 to 3 months, we have the managers working with their staff to build their action plans.
Mhm.
So then by, let's say, April, they're entering their action plans into the Press Ganey portal where we track them and monitor them. And then we give them a few months to actually implement all of their action plans. And during that whole time, we're tracking, we're following up, we're making sure people are doing what they do. So probably, from beginning to end, it's probably a 1-year process. But
Mhm.
it's really a never-ending process because we're continuing to get feedback informally through conversations and continuing to make improvements every day.
So it's really continuous quality improvement.
Yes, that's a great way to say it.
Yeah, just in a different
Yeah.
venue.
Yeah.
How are the action plans that are created? How do they get sort of monitored and tracked? Who does that?
Yeah. Well, I say, bless Kate Guggenheim. Kate is our Director of Employee Engagement, and she is phenomenal.
She is wonderful.
And if there's anybody who lives and breathes employee engagement, it really is Kate. But she and her team really go in and pull reports out of Press Ganey for us. So they look at the action plans, they review the action plans, make sure they're meaningful, make sure they're specific, quantifiable, etc. And then she runs tracking reports for us, shares them with the senior leadership team, and we follow up. And honestly, thanks to your commitment, thanks to Carol Gomes' commitment, we have such commitment at the top, and we'll personally reach out to the leaders who may not have gotten their plans in to see what can we do to support you, what can we do to help you, and what can we do to make sure that not only are the action plans being implemented, but that we're keeping the employees, our employees, updated on where we're at.
That's so important. I mean, it's very easy to be supportive of this because, as you said, employees who are engaged and enthusiastic about coming to work provide better care. And of course, that's the core of whatever we're doing. But also, it's so much better to be able to be enthusiastic, to look forward to coming in every morning. It makes a world of difference in just everybody's lives. And I think that's a key thing for everybody, for all of us. Tell me a little bit how this is translated into, say, recruitment or retention. What have you seen over the years?
Yeah, great questions. We are so thrilled and proud of our recruitment and our retention success. So I often say when people think about staffing and they say, oh, what can we do to improve staffing? I think most people think recruitment. I think retention. I think retention is the core and the key. It starts with keeping our employees happy, doing right by our employees, taking good care of our employees. And if we do all of those good things, we will retain them. And then we will have less of a need to recruit.
Right.
But we know we always will have a need to recruit because, certainly people retire and people's career choices change and so forth. So we've implemented a really robust recruiting strategy. Lynn Alba is our Director of Talent Acquisition. I always say Lynn is a bundle of energy and so passionate, and she and her team have done such creative things. We've done all kinds of career fairs. We're out in local libraries. That was Carol Gomes' suggestion, by the way, but we're out in local libraries. We heavily leverage LinkedIn and other social media platforms. We've had great success. Our vacancy rate is under 5%.
Wow.
Which is really unheard of. The industry averages are 10 to 12%. And our RN vacancy rate is less than 3%.
That's incredible.
It really is. I mean, the averages are 15% and ours is 3%. So it really is something that we're very proud of. And our turnover rate, which again, retention, our turnover rate is like 4.28%. And the averages, again, in healthcare are well over 10%. So we're really, really feeling good that the feedback that our employees share with us turns into action, and that action yields results. And it has helped us really increase staffing. When we look at graphs of the number of staff, it's just goes straight up. We now have 8,150 employees, which I think is our new record.
That's great. I think every time I talk to you, you say we've set a new record.
We keep going.
That's great. So of course, part of that is the employee engagement survey and us acting on information that we get back from our employees. But some of it also is recognition. Tell me a little bit about recognition programs. What sorts of things have we brought to our staff for employee recognition? And how do we think about that in the larger context of employee satisfaction and retention?
Yeah, no, that's a great question. And it's interesting with recognition and a lot of research about human behavior and how we react, and we all want to be appreciated. It's a core of who we are. We want to be recognized. We want to be appreciated for what we do and for our contributions. So we could talk about, and we have a lot of wonderful programs, but to me, the one that's most impactful is probably the Stony Brook Stars program, because it's all about simply saying thank you. Simply saying, I appreciate and recognize what you did. So that program has been a tremendous success. And it's one that's been in place for a few years now, but we continue to sustain it and support it. And then we've layered a whole host of other ways that we can express gratitude and recognition. We recently introduced, we call it our 90-day hooray. We invite employees who just completed their first 90 days to join us in a celebration where we simply thank them and chat and welcome them officially to Stony Brook. We introduced a new career service milestone program where we celebrate employees' important anniversaries with us. We do retirement clap-outs that are so moving. We just had one last week where employees line the hallway and the employee who's retiring walks through a line of people just clapping and sharing their love and their friendship. So a number of things like that. Of course, we have our Employee of the Month program. We celebrate National Hospital Week. And I'm sure I'm missing a few, but those are just a couple.
Yeah, those are great. They're all wonderful programs. And I love the clap out, the retirement clap out. But I just want to talk about the STAR program for a moment, because to me, that I think is so great. A lot of recognition programs, not necessarily here, but overall sometimes feel like a competition. And this is not a competition, right? Anyone can say, you know what, Colette, you did such an amazing job helping this patient or helping me or whatever it is. And, I can fill out a request for a STAR card to go to you. There's no limit to how many somebody can get. Everyone can participate. And I think in some ways, it is almost as beneficial for the person who writes the card, showing their gratitude, as it is for the recipient. So I think it's just a wonderful, wonderful feature.
I totally agree. And you're 100% right. Any employee can give any other employee a STAR card. You could give your supervisor a card. Your supervisor could give you or anybody else. And now we made it even easier. You could fill them out on paper. You could fill them out right on the pulse.
Right.
And any employee who gets 3 STAR cards comes down to Kate's office on level 5 in the hospital and gets a Stony Brook branded item, just as an expression of appreciation.
That's great. I think it's a wonderful program. So thank you.
Thank you.
Tell me a little bit about, I'm going to switch gears.
Sure.
Tell me a little bit about compensation. How do we continue to invest in making sure our compensation and our benefits are really competitive with what's a very competitive market right now?
Yeah, you're absolutely right. It is a truly competitive market, healthcare, particularly on Long Island. So we participate in a number of salary surveys where you're able to look at and see, what's the going rate for a clinical lab tech? What's the going rate for a respiratory therapist? So we look at that data. We also carefully evaluate our vacancy data and our turnover data. We also do exit interviews, or exit interview surveys. So we look at all this data to try to really stay ahead of where are we at, where is there potentially a gap. And then we do an analysis. So for example, we've done adjustments for our clinical lab techs quite a few times. We've done them for respiratory, radiology, most areas. But we look at the data and then we put together a plan. We do a cost analysis. Of course, we come to our CFO and our CEO and to you, Bill, and everybody's been very, very supportive. And over the last 5 or 6 years, we've invested over $50 million in non-contractual salary enhancements. And that really has played a big part in our ability to retain and our ability to recruit. Now, are we ever going to be able to, have the highest salaries for every position everywhere? No, because we know we have limited resources. So we have to make sure it's balanced and it's sustainable. But we continue to, we really continue to monitor it closely. We also continue to advocate at the state level for some of the positions where we don't have the ability to make these decisions ourselves.
Right.
So, for example, for CSEA employees, We've advocated and been successful for several positions. We're continuing to advocate, and we won't quit until we get there for cleaners and nursing station clerks and some other positions.
Right. I think it's so important. And I think it's important for people to see that there are things that we can do, like increase on a non-contractual basis, but also that at the same time, we're talking to our friends in Albany and saying, look, we really need this.
Yes.
And the situation here on Long Island, as people know, is different than perhaps in Syracuse or Buffalo, and we have to think about things differently.
Exactly.
So great. That's really, really helpful. What about our benefits? Are there anything about our benefits packages that you've tweaked or we've had to pay closer attention to, or how do they compare across the market?
Yeah. Interestingly, we don't have the ability to tweak anything on our benefits program, but we're so fortunate because New York State has among the most competitive benefit programs out there.
Mm-hmm.
I mean, we have a wonderful health insurance, medical insurance, dental, vision, our retirement benefits. I mean, we are among only 25% of employers across the country who still offer what's called a defined benefit plan, and that's our employee retirement savings plan. Mm-hmm. And basically what that means is you don't have to worry about what the market's doing. You're guaranteed this monthly benefit when you retire. And that really has, as some people say, they've gone the way of the dinosaur, these types of programs. So we're still among the rare employers who offer that program. And we also offer, for many of our employees, depending upon the contract, the option of a defined contribution program as well, where I put in a certain amount of money and Stony Brook matches it. And then, I have the opportunity, hopefully, to do well with my investment strategy.
Right.
And of course, we have a really generous time off benefit program. So it's really, that's a wonderful thing about working for New York State is we really have a unmatched benefit program.
Yeah, definitely very important.
Mm-hmm.
Definitely very important. We talked a little bit about sort of leadership and the support. Let me just ask you this. If somebody after hearing all this is still a little bit on the fence about participating in the survey, what would you say to them that we haven't already talked about?
Yeah, I would say, it's an investment of probably 15 minutes of your time. It's on work time. We'll pay for you to take the survey. It's about 15 minutes of your time, and the impact can be tremendous. To me, it's almost like I don't want to miss the opportunity to vote because it's my opportunity to share my voice. Mm-hmm. And this has even more of an impact because, we're going to do something. If I vote for somebody, my candidate may or may not win. Right. But if you share your voice, that information is going to be seen, it's going to be heard, and we're going to act upon it. So, and it also benefits not just you as the individual employee, but it benefits your colleagues. It benefits our patients because each individual employee has a unique insight and unique feedback that nobody else can share with us. And we really value that.
That's great. Very important.
Mm-hmm.
I'm going to ask you to look into your crystal ball for a minute and imagine we're 5 or 10 years in the future. What are some of the things that you think we'll be asking of our employees? What are the things that you think will be important in terms of employee engagement? But maybe are some of the pressures that you think will be on us?
Yeah, it's interesting. And, I think that some things will stay the same. I think the core things that will stay the same is we'll always want to be appreciated and recognized and valued. I think some of the things that will change and will need to evolve as an employer, as the needs of our employees change, are things like how are we leveraging technology to help them do their jobs? How are we leveraging technology to make the work easier, more manageable, to allow them to do different things and use their creativity in ways that maybe they haven't been able to fully optimize? I think remote work for those who do not have a physical presence needed, which is just a small percent of our employees. Most of our employees are at the bedside, are caregivers. But for those where remote work is an option, I think that will continue to be something that our employees will look for. Work-life balance will continue to be something that we need to pay attention to. How can we be creative with scheduling? How can we be creative with making sure that we're fully staffed, but at the same time that employees can unplug and can enjoy that time away from work? And I think just continuing to be really cognizant of that each of our employees is a whole person, and that we look at them that way, and we treat them that way, and we honor and value them that way. I think, those are the things that I see in my, I don't know, not so highly shined crystal ball.
Looking a little foggy.
Yeah.
Well, we won't hold you to any of these, but I think they're really important ideas. One of the things that I want to emphasize that you talked about is ways that technology can help us do our jobs. And speaking certainly for anybody who is in the clinical realm, actually interacting with patients, we know from other literature that one of the major triggers of burnout in people who are clinical are the tasks that take them away from taking care of their patients and interacting with their patients. So to me, being able to flip that because most of those tasks are technological in some fashion, but being able to flip that so that technology takes care of itself or enables us to walk away from a computer or something like that, so we can go back to the bedside or go back to talking to a patient, I think is so important. So that's, I think, an important part of this.
Completely agree.
So thank you so much for joining me today, Colette. It's a pleasure to have you on Morning Rounds. That wraps up today's episode. Supporting and engaging our people is at the core of who we are at Stony Brook Medicine. It's how we create the best environment for our teams and our patients. So once again, thank you for joining us today.
Thank you, Bill. My pleasure.
And all the incredible work that you and your whole team are doing to make Stony Brook Medicine an even better place to work. To everyone across our system, thank you all for the care you give, the passion you bring, and for sharing your voice. It truly matters. So, until next time, keep the coffee brewing and innovation flowing at Stony Brook Medicine.